For more on this, then, we'll cross to our Beijing correspondent, Yena Lee. Hi, Yena. So the first big holiday since the end of zero COVID is over. Is it fair to say that things are completely back to normal?
Well, it certainly almost feels like it. State media reported that there was an increase in 74% in trips over the Lunar New Year holiday period compared to last year. And it's not over. Chinese railway services estimate that 11.2 million people will be taking trains on Monday alone. That's a little bit less than on Sunday. And this, of course, does fit in with that official narrative that we've been seeing on state media, on state television, reminding people that things are back to normal. Chinese New Year was back to normal. Everybody was traveling. Everything is fine. And it certainly does seem so on the surface here in Beijing. I saw huge queues once again outside the Summer Palace. Groups of domestic tourists are traveling together, visiting scenic spots in the city. The only real remnants of China's zero COVID policy that you can see for yourself in the streets are empty testing booths. But still, it must be said that the numbers of trips that have been taking place over this Lunar New Year period is half that of pre-pandemic levels. So things aren't 100% back to normal. And what we don't see in the streets is that at least 80% of the population contracted coronavirus. And this is according to a top Chinese health official. And that means that at the very least, tens of thousands of people have died from that disease. And many more are grieving the loss of their loved ones. Of course, China's sudden U-turn on zero COVID policy, the surge that happened afterwards in coronavirus cases, all still very recent.
So, Yena, did that holiday period then wreak havoc on rural regions in specific, as was feared?
Well, that really is very hard to say. What I can tell you is that there was a lot of criticism towards Chinese authorities about their coronavirus figures. And in recent weeks, they have been releasing a more comprehensive number of deaths, even though those numbers still aren't perfect. They're not perfect, but they are showing some sort of a trend. Their latest statistics that cover the week of January 20th to January 26th show that the number of deaths have halved from the week before. And that period comprises a start of Lunar New Year festivities. But these numbers are limited for a number of reasons. First of all, they don't take into account deaths that take place in care home facilities, people with underlying diseases and conditions, and perhaps most relevant to your question about rural areas, these numbers only take into account hospital deaths. And in many parts of rural China, the medical infrastructure just isn't as robust as it is in these big coastal cities such as here in Beijing. Parts of rural China, clinics can at times be very remote and rare. What we only have, unfortunately, is anecdotal evidence from a fellow journalist traveling to different regions of China. But anecdotal evidence is, of course, also very limited. Their reports suggest that the number of deaths in rural parts of the country have indeed been underreported. By how much, we don't know, and we won't know for a while.
Yena Lee in Beijing, thank you very much.